Hey everyone, and welcome back to Zen Zone Health. Today we're diving into 11 warning signs your face and body might be sending you that you should never ignore. We're talking about those subtle, sometimes overlooked signs that could be trying to tell you something more serious is going on beneath the surface. So whether you're a health enthusiast or just looking to be more in tune with your body, this video is for you. Let's break down these warning signs together and empower you to take control of your health, one step at a time. Alright, let's kick things off with a sign you might not expect: thinning eyebrows. If you notice significant or sudden thinning, especially in the outer third of your eyebrows, it's worth paying attention. This could signal hypothyroidism, where your thyroid gland isn't producing enough thyroid hormone. This hormone influences everything from energy levels to hair growth. Thinning eyebrows can also be linked to conditions like atopic dermatitis, causing dryness, itching, and hair loss. So, if you're noticing those brows getting sparse, don't just reach for the eyebrow pencil. Talk to your doctor and get those thyroid levels checked, just to be safe. Let's move on to another area of the face that can reveal a lot about your health: your skin. Persistent, stubborn acne or unusual hair growth on your face could be a sign of polycystic ovarian syndrome, or PCOS. PCOS is a hormonal disorder caused by an imbalance of hormones leading to small cysts on the ovaries. This imbalance can cause breakouts and excess hair growth. Other symptoms include irregular periods, weight gain, and mood swings. Early diagnosis and management of PCOS are key to preventing complications like type 2 diabetes and heart disease. Don't hesitate to reach out to your healthcare provider if you have any concerns. If you notice persistent red rashes or bumps on your face, particularly on your cheeks and nose, it's time to pay attention. This could be your body's way of telling you something's up with your digestive system. One potential culprit is celiac disease, an autoimmune disorder triggered by gluten. When someone with celiac disease consumes gluten, their immune system attacks their small intestine, leading to inflammation and malabsorption of nutrients. This inflammation can manifest on your skin as red rashes. Celiac disease can also cause digestive issues, fatigue, and weight loss. Another condition that can cause facial rashes is lupus, which often causes a butterfly-shaped rash across the nose and cheeks. So, if you're noticing persistent rashes, don't just slather on the moisturizer. Talk to your doctor to rule out any underlying conditions. We've all been there, those dark circles under our eyes after a late night or a stressful week. But if those under-eye circles are accompanied by redness, swelling, or dark patches, it could be a sign of something more. One potential culprit is dermatomyositis, a rare inflammatory disease affecting muscles and skin. Dermatomyositis can cause a purplish-red discoloration around the eyes and muscle weakness. In some cases, it can also affect internal organs like the lungs and heart. If you notice any accompanying redness, swelling, or muscle weakness, see your doctor right away. Let's talk about a sensation that can be quite alarming. A sudden, intense tearing sensation, especially in your back. This isn't your typical muscle soreness. It feels like something is ripping or tearing inside you. This can be a sign of a ruptured aorta, a life-threatening condition requiring immediate medical attention. The aorta is the largest artery in your body, and when it weakens, it can bulge or tear, causing excruciating pain. This pain often radiates to your back, between your shoulder blades, but can also be felt in your chest, abdomen, or jaw. If you experience this type of sudden, severe tearing pain, call 911 immediately. Let's talk about another type of pain that should never be ignored: chest pain. While some chest pain can be caused by muscle strain or heartburn, the crushing chest pain of a heart attack should always raise a red flag. A heart attack occurs when blood flow to the heart muscle is blocked, usually by a blood clot. This blockage starves the heart of oxygen, causing damage to the heart muscle. The pain is often described as a heavy pressure, tightness, or squeezing sensation in the chest. It can also radiate to other areas like the arms, jaw, back, or stomach. Other symptoms include shortness of breath, nausea, vomiting, sweating, and lightheadedness. If you experience these symptoms, call 911 immediately. Let's talk about reproductive health. If you experience painful periods, pelvic pain, or other unusual symptoms, don't just grin and bear it. These could be signs of underlying reproductive health issues that need attention. Other red flags include bleeding between periods, unusual vaginal discharge, pain during intimacy, or difficulty getting pregnant. These symptoms could indicate conditions like endometriosis, fibroids, or hormonal imbalances. Ignoring these signs can lead to complications like infertility or chronic pain. Speak to your doctor about any reproductive health concerns you may have. Ever get that pins and needles feeling in your hands, feet, or face? If it happens frequently or persists, it could be a sign of something more. This tingling, often described as paresthesia, can be caused by a variety of factors. One common cause is nerve compression, like when you sleep on your arm wrong. However, persistent tingling can also be a sign of conditions like diabetes, multiple sclerosis, or vitamin B12 deficiency. Diabetes can damage nerves, leading to diabetic neuropathy, causing tingling, numbness, or pain in the extremities. If you're experiencing frequent or persistent tingling sensations, talk to your doctor. Let's talk about dizziness. If it becomes a frequent occurrence, it's important to pay attention. Dizziness can be caused by a wide range of factors, from dehydration to inner ear problems and heart conditions. One common cause is benign paroxysmal positional vertigo, or BPPV, affecting the inner ear. BPPV occurs when tiny calcium crystals in the inner ear become dislodged, creating a spinning sensation. Another potential cause is Meniere's disease, which can cause vertigo, hearing loss, and tinnitus. If you experience frequent or severe dizziness, especially with other symptoms, seek medical attention immediately. Let's talk about breast health. It's crucial to be familiar with your breasts and aware of any changes. Breast cancer is common, but early detection significantly increases the chances of successful treatment. Signs to never ignore include any new lump or thickening in the breast or underarm area. Other red flags include swelling, redness, nipple discharge, or changes in the size or shape of the breast. Regular breast self-exams and mammograms are essential for early detection. Finally, let's talk about mental health. If you're experiencing persistent feelings of sadness, anxiety, or loss of interest, don't ignore these signs. These could be symptoms of mental health conditions like depression or anxiety disorders. Other red flags include changes in sleep patterns, appetite, energy levels, or thoughts of self-harm. Mental health conditions are real medical conditions that require professional help. If you're struggling, reach out to a mental health professional. There's no shame in seeking help, and it can make a world of difference in your overall well-being. That's it for today's video on 11 warning signs your face and body might be sending you that you should never ignore. By paying attention to these signs and seeking medical advice when necessary, you can catch potential health problems early on. Thanks for joining me today on ZenZone Health. If you found this video helpful, give it a thumbs up, share it, and subscribe to my channel for more health tips. Until next time, stay informed, stay healthy.